Good morning, everyone. My name is Pamela Robinson. I'm a professor and the director in the School of Urban and Regional Planning at Ryerson University. I'm also the interim academic lead for City Building Ryerson. Welcome this morning to our webinar called How Can Cycling Infrastructure Save Lives? We're super excited today to welcome Dr. Ann Harris as our presenter and my co-host Sue-Mi Cheng. And in this session today, we're going to have a session that focuses on a presentation that will run about 17 or 18 minutes with about 10 minutes opportunity for questions and answers at the end. My co-host today is a graduate student in the Social Policy Studies program at Ryerson University. She's a doctoral candidate, and her research focuses on community building and community-based integrated health and social care for older adult populations. Sue-Mi brings over 25 years of experience in public and health and social science sectors, and she's held leadership positions in governments, including in agencies in Alberta and Ontario, and in the not-for-profit sector, including the Ontario Public Health Association. Over to you, Sue-Mi.
Thank you so much for your kind introductions, and I'm delighted to be part of this presentation. So while we are meeting virtually today, I wanted to begin by acknowledging the space in which the Ryerson campus and community is situated. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. You will also have seen our welcome slide that today we are recognizing Orange Shirt Day, and I'm wearing that. Today, the Ryerson community joins together in the spirit of reconciliation to provide space for conversations on the legacy of residential schools, and we wear orange shirt to show our support and honor survivors.
Thank you, Sue-Mi. So a few housekeeping notes before we get over to the central attraction, which is Dr. Harris's research. Her presentation will last roughly 17 to 18 minutes with an opportunity for questions and answers. You'll find at the bottom of your Zoom screen a question and answer box where you can enter your questions. If someone else asks a question that you find particularly compelling, we welcome you to help vote it up so that we can try to answer the questions that are the most resonant with the audience. At the end, if we haven't had a chance to capture all of your questions with answers, we'll provide an opportunity around how to connect with Dr. Harris to learn more about her work. So without further ado, I'd like to turn the table over to Dr. Harris. As we're presenting, everyone's microphones will be muted and people's videos will be muted as well. Dr. Harris is an epidemiologist and an associate professor in Ryerson School of Occupational and Public Health in the Faculty of Community Services. A major focus of Dr. Harris's research is on road injury epidemiology, bicycling, and pedestrian risk. Anne recently completed a study with City Building Ryerson that estimates the bicycling injuries that could be prevented through the installation of safe and separated bike lanes in our city, which is obviously of tremendous importance given the city building efforts that are taking place in Toronto right now across Bloor-Danforth. And she also explores how cycling volumes may change in response to COVID-19. The full report was released yesterday, and we encourage you to check it out on the City Building Ryerson website. I'll now pass it over to Dr. Harris. We look forward to learning more about your research. Thank you.
Okay, hi everybody. Thanks so much for coming, and thanks for having me to this city building series and giving me a few minutes. It's a little bit tight to talk about this study that we've just released with City Building, and it's a two-parter. There's a report that was written by City Building and also a report, technical report, which shows all our analyses and how we did them. And you can get both reports on the City Building website. I included a QR code here in case you want to download it. I want to highlight my co-authors, especially Callum Thompson, who is our MPH practicum student. He is studying epidemiology at the University of Toronto. So he did his research practicum from May to August, all on Zoom, as we are now. And he conducted the analyses that you're going to see today. And I also want to mention our co-author, Michael Branyan-Callis, who is my postdoc, and he is studying injury risks in a national linked cohort for bicyclists and pedestrians. And he provided invaluable expertise on modeling and our overall approach. So this study goes back to 2019. It's been a little over a year, and what a year. It was funded by the Metcalf Foundation through City Building to have us calculate the burden of bicyclist injury that could be prevented by physically separated infrastructure. And in consultation with various stakeholders and community groups, we determined the Bloor-Danforth corridor to be the location for our study. So this happened back in summer of 2019. This is just a reminder of what Danforth used to look like. So why should we focus on physically separated infrastructure? I wanted to just take a minute to highlight why we think this is so important. And I go back to some criteria that were laid out by injury epidemiologist Mary Chipman in 2002 for what makes a good intervention to prevent injury. So she recommended that good interventions should be population-based, meaning that they cover a whole population and kind of can blanket protection without having immediate engagement or differential protection necessarily. It should also be something that's passive, not that it's passive to get infrastructure installed, but that once installed, we're dealing with an intervention that doesn't require you to engage directly or say shields up. It's something that protects you just by existing. It's a single action after installation, meaning that there's some reduced need for repeated enforcement. And in theory, the idea is physical separation becomes its own kind of enforcement, and that it's omnipresent and hopefully unbiased. So what this study that I'm going to talk to you about is a new test of infrastructure risk effects or any collection of new injury data. It's also not a comprehensive analysis of all of the potential benefits of separated bicycling infrastructure. There are lots of those. We talk about some of them in our report. There could be for air quality, physical health or physical activity, prevention of injuries to other road users, including pedestrians. But we're narrowly focusing on preventable bicycling injuries that we know could occur because of the protective effects that have been documented by other research. So how are we going to calculate this? We're going to do a pretty simple calculation. We did a simplified formula here. So if we think of the burden of bicyclist injury, meaning the number of injuries that might occur on a road segment, we could take the length of that segment in kilometers, multiply that by the total number of bicyclists on that segment, let's say in a year, and then we would multiply that by a measure of injury risk. And this is going to be a two-piece measure that includes the number of injuries over the person kilometers, total person kilometers traveled that go along with that measure of total injuries. This is actually something that's a bit tricky to calculate. We used an overall measure for the City of Toronto rather than trying to target it at locations. We are aware that's dynamic in time and space. So this would tell us the number of injuries that might occur on a segment with no interventions. If we're going to add a protective intervention, we need to multiply that burden by a ratio that incorporates the information about how protective the benefit is. If something is really protective, then this will be a fraction. It's going to be less than 1. And that means we're going to end up with a fraction of the injuries that we had without the intervention. And if we just subtract one from the other, we can see the difference in the number of injuries that we prevented. So that's our overall task of calculation. And now we just have to assign values to each of these components. I'm just going to run through that as quickly as I can. So what about the street segments that we included? We picked our street segments back in 2019 as locations where there was not, at the time, bicycling specific infrastructure. Generally, what we're trying to do here is exclude locations that had bicycling infrastructure already installed because we didn't want to double count benefits. That's probably a conservative approach that means that we might even have more benefits if these segments have been improved on infrastructure. But there's some caveats there that I'll talk about later. Next, we've got to know something about volume and the number of bicyclists. There have been lots of counts on Bloor and Danforth. none in these specific segments directly. So that was something we thought we could maybe contribute to with some original data collection. And we did that starting in fall of 2019. We planned to do a full year of collection. We had an undergraduate RA out there counting, intrepid, come what may. She was out in all different conditions. And I'll highlight, she did a lot of counts in the winter. And I know this comes up a lot. She almost never went to a location to do a 20-minute count and saw no bikes, even in winter. Toronto cyclists bike in the winter. Well, something happened in March of 2020. And when the pandemic hit, it was no longer safe for our undergraduate RA to be out there counting. And not only that, but the data just wouldn't make sense anymore because of lockdown. So then we use a modeling approach to use some adjacent city-run count locations that use loop counters to help us model and estimate the counts that we couldn't do due to COVID-19. Then we also thought COVID-19 is going to change transportation in our city, and lots of people have been studying that. There's some evidence towards that. So we incorporated some possible increases in bicycle volume due to COVID-19. This is what the city did in response to COVID-19. This shows some of the changes, this rapid expansion, I think faster than a lot of us were expecting. And what a great thing this has been to see over the last few months. Some of this infrastructure that has been installed was designated as permanent and some as temporary. So in the roughest possible way, it could be that our estimates provide benchmarks for what the preventive benefits could be of this installation, assuming some caveats that I'm gonna hit you with in a minute. For our injury risk calculation, we started with police data. In Toronto, the police publicly release information on killed and seriously injured cyclists. That's not true in every city, so that's a thing we have here. But we know that a lot of injuries are not reported to police. There's lots of reasons for that. That's an area of research interest for me. We're interested here in injuries seriously enough to require an emergency department visit. So we derived a correction factor to try to adjust for underreporting of police. When we did that, we came up with a risk calculation for the city as a whole, which we kind of assumed applies everywhere, of 0.24 injuries per 100,000 person kilometers bicycled. That's about 500 a year in the city. Then we had to come up with some measure of the preventive benefit of the infrastructure. And so for this, we went to existing studies. We looked at a lot of studies, and in the end, we settled on including 2 particular studies and taking our measures from those. These are studies that had Toronto data collection. So one is a study that I was part of many years ago that included Toronto and Vancouver. It was a case crossover design. We recruited participants from emergency departments who were injured bicyclists. In this study, we found that cycle tracks were associated with an 89% reduced risk of injury, roughly. And we also wanted to include a more recent study from 2020 that examined cycle tracks as implemented in Toronto since this study had been done. So this study from just this year looked at cycle track locations in Toronto, including Richmond, Adelaide, Wellesley, and Sherbourne. And they used police data to look at risk before and after, and they adjusted for bicycle volume. This study found a very different protective effect. They found a 38% reduction, still a reduction, but not as strong. There's a lot of differences between these 2 studies, so I wouldn't expect them to produce the same result just because of the very different way that they're designed. And of course, there's statistical margin of error. But one of the things that jumped out to us in reviewing these is the different definitions of cycle tracks. So back when we did this study, cycle tracks, we kind of made our own definition and said they had to be fully physically separated from motor vehicle traffic. And in this study, they used the term cycle track as it was used by the City of Toronto. That makes sense, they're evaluating City of Toronto infrastructure. But are these really the same thing? Nomenclature on bicycling infrastructure is tricky. So I just want to call out some work of colleague Megan Winters and some of her collaborators who just published this CAN bikes classification system. And here are a couple of examples of cycle tracks as they showed them. And you can see that they are fully physically separated. So we took this as informative to say, well, we think maybe we're going to assign an 89% reduced risk for a high protection scenario where there's complete physical separation. And maybe if we're seeing locations that do not have complete physical separation, they're permeable or semi-permeable, we're going to call those lower protection scenarios and assign them what we think might be appropriate of a 38% reduced risk and another 46% reduced risk. This was for painted bicycle lanes with no parked cars in our older study. We also factored in a safety in numbers effect for the increases in safety that seem to be observed as their volumes of bicyclists increase. And we wanted to factor that in because that's been documented in a number of studies. So here are our key results. There's lots of results in the report, but I wanted to call out these in particular. I wanted to show you the results across 10 years. There's a few reasons for that, but the key one is because this is why you install infrastructure. The benefits accrue over time. It's not something that you look at just immediately. Not only do they accrue over time like any investment, they can actually compound because of that safety in numbers effect. So you can actually see the benefits increase as time goes by. So you want to put them in and then watch the benefits pile up. So in this case, if we install fully high protection, fully physically separated infrastructure, we can expect that we might prevent along these segments about 150 to 200 bicycling injuries that would maybe require emergency department visits. Now, the exact scale of that depends on how much bicycle volume changes in response to installing the infrastructure and, of course, as the modes of transportation might shift a little post-pandemic. If we do not install fully physically protected, we're not going to get the same benefits. We will have some benefits, but maybe preventing about half the number of injuries. If we look at fatalities, you can see the numbers are much smaller. This is because fatalities are fortunately rare, not as rare as they should be. So we could prevent maybe one fatality over the course of 10 years under a high protection scenario. One limitation I'll just quickly mention here is that because these fatalities are based on police data, we're talking about fatalities that occur essentially on road or very soon after. And one thing we know about injuries is that there's an increased risk of mortality even following injury for some time. So the number of deaths that would be prevented are probably more than just the on-road fatalities if we prevent all of these injuries. Some select key conclusions of our analysis is that we need physical separation for the full benefits to be observed. We also need the routes to be unobstructed. Our analyses are pretty simple, so we're assuming that all of the infrastructure is accessible and not obstructed at all times. Now, we've all seen obstruction riding around. This is a picture I took on my commute back when I had a commute, showing some example of obstruction that we've all seen. In previous studies, we know that obstruction poses a risk to bicyclists. So we want to keep an eye on that. And one of the concerns that I've had just observing some of the infrastructure that we're putting in is the potential for the infrastructure itself to become an obstruction. And I had sort of seen this, and I asked on Twitter for people to send me photos, and people obliged. Thank you so much for sending these pictures. One of the things you see is lots of downed flexi posts everywhere, and sometimes those flexi posts can end up obstructing the lane itself. So that's a little bit of a concern. I'm now going to take a very quick pedantic side trip just to talk about flexi posts. I've noticed that these are sometimes called here in Toronto bollards. My understanding of a bollard is that it is definitionally inflexible. So I'm not sure these should be called bollards. But also I think we should just look at this in the context of thinking about those studies on risk and thinking about whether we think something like this is fully physically separated, or is it permeable? Here's one where there have been concrete barriers installed, but the concrete barrier has been knocked out of place and could potentially form an obstruction. So that's something we should be aware of and maybe collect some data on going forward. We probably need a whole separate talk to talk about intersection interventions. That's a limitation of our analysis. We didn't do a separate analysis for intersections, but we talk a little bit about that in our report. We also need to think about permanency. This is crucial. So in order to see those 10-year benefits, we have to commit and put this infrastructure in permanently. And I'm especially concerned about a potential bait and switch where we attract users to the corridor with infrastructure, then take it out, the protective benefits are removed, we could actually see more injuries afterwards by attracting more users in this bait and switch. And then I always like to highlight that we need good data on the injuries that occur in our city, and we need more information than just police data. We need more information on number of riders and their kilometers traveled. And ideally, we would do this in a national study so we can compare between cities. That's just something I'm passionate about. So there are lots of caveats and limitations to our analysis, and our technical report has details on those. If you read no other parts of the technical report, please do read the caveats and limitations section. This was actually something I saw when we were out piloting our data collection, was just somebody had painted, it doesn't have to be perfect on the sidewalk. I thought that was important to remember. Thanks so much to everyone who contributed to this project that's been going on for a while, and thanks to you all for coming. Now I'm excited to hear your questions.
And thank you so much for sharing this very timely, impactful, and important research. I'm going to turn the microphone over to my colleague Sumi to ask the first question, and then we're going to turn to the Q&A box where some of our participants have posed questions. So Sumi, over to you. Sumi, you're still on mute.
Sorry about that. I just wanted to say great presentation, and very excited by the findings. Certainly during my time with the public health sector, active transportation had been an active policy and planning advocacy priority of the province, and it's great to see one silver lining during COVID in the form of the active TO. And I think your findings kind of further cement and support that continued move towards active transportation. In your report, I was very intrigued by the fact that you had mentioned that these permanent barriers or formal separations could actually have some equity implications. And I wondered if you might explore that reference. Furthermore, I'm wondering if there might be some demographic data on those who are injured, especially in light of the equity piece and COVID being such a time period in which equity is so much highlighted. And lastly, how would the move towards creating these separations and barriers impact this issue of equity? So a three-pronged question. My apologies.
Okay, I'll do my best to attack that as best I can. So first of all, I did comment on this, especially in the limitations section, that this is not something that's directly addressed by our analyses. Part of that is, in order to understand the equity offered by a given implementation, you need to know really detailed user data on the corridor, and we were just doing these simple counts. So there are data that have been collected by others. There's lots that's known about equity and access when it comes to designing locations. That comes from planning. I want to highlight work here by Cashlyn Firth, who works with Megan Winters at the Chatter Lab at Simon Fraser. And also, I know that Raktim Mitra is presenting to this series, and he does work on equity and access to different types of infrastructure. You also asked about equity when it comes to who bears the burden of injury, and we know that that is not equitable. So that's not equitable in two ways. One, we know that equity affects who gets injured, and some work by a colleague of mine, Linda Rothman, who's presenting next week in this series. She's done work in the past that shows that children of lower SES are at higher risk of pedestrian and motor vehicle collisions. And we think that's probably holds for other types of active transportation. And then we also know that the burden of injury after injury is affected by equity. So we're interested now in doing some work on what happens to people after they're injured. And there's not a lot of data on that for Ontario. But one thing we know from other locations and other studies is that that tends to be impacted by equity. That various factors of being marginalized will affect how injury impacts people's lives. So I'll leave it with that for that question. I hope that's enough, but a limitation of this study.
Thank you, Anne. I'm going to take a question from Rye Schisler. Do you know the person-kilometer injury rate for drivers, passengers, and pedestrians?
Okay, that's a really good point. I don't off the top of my head because we haven't calculated those. These are actually, it sounds easy, but it's not that easy to calculate. We did a study of this in Vancouver using BC data. I'm going to say this would be about 5 years ago. And in that study, as in many others, we find that the rate of injury is higher for bicyclists and pedestrians than it is for motor vehicle occupants. So that's been seen in a few other studies. And I can't give you those exact numbers, sorry.
And I have a question from Rita, and she asks, how does your research findings specifically impact or relate to student pedestrian cyclists, given that Ryerson has now completed the construction on Gould Street?
Okay, yeah, that's a good question. So I think it's worth considering who is your user base when you look at different corridors. And that's, again, a limitation of this study that we didn't factor that in. I think when it comes to looking at a location, it's important to consider who's going to be using it and what modes of transport they're going to be using. But also you want to not just build for what's there, but what might be coming in. So I will have to say that it's been a while since I've been to campus, so I haven't seen our new improvements to Gould Street yet, but I can't wait to see, I can't wait till we're back there and I can see them in person.
Thanks, Anne. We have room for one more question. I'm going to take a question from Bartek Komorowski. Did you consider using automatic counters or video analytics instead of sending out a student to count?
Yeah, so that's a good question. So automated counters provide lots of benefits in that you can put them down and you don't necessarily have to be there to monitor them. The reason we thought we would use actual human observation is to give us some basic information about users on the corridor. So she did do some eyeball calculations of age and gender along that route. You can do that just as well with video footage. That was a feasibility issue of whether we would have a location and equipment to put up video observation. Both great ideas.
That's great. Okay, I'm going to sneak in one more question before we wrap up at 11:30. This comes from Gil Penaloza from 880 Cities. Have you measured the impact of additional users for isolated protected bikeways as opposed to the networks that connect origins and destinations?
Okay, thank you for this question. So yeah, I think it is one of our challenges is to say, a limitation of this analysis is that it is kind of pulling segments out as if they can be analyzed independent of each other. And that is probably a problematic assumption because we know that there is a safety consideration. And it's kind of like a version of that bait and switch that we talked about when we talked about temporary infrastructure. It's also a bait and switch if you have a broken network. And the intersections factor into that as well. That's a way of breaking up the network. So you really need to have a connected network with attention paid to intersections if you're going to get the full benefits.
That's great. Thank you, Anne. So we're coming up on 11:30. I'm sorry that we didn't get a chance to get to everyone's questions. Anne's contact information is available, and I know she'd be delighted to hear from you about her research, whether it's on Twitter or through a Ryerson email address. A recording of this webinar is going to be placed on the Ryerson website, so if you found it interesting and you want to share it, we'd be really grateful. If you go to the City Building Ryerson website, we'll be able to help you connect with it. And we also have 2 more sessions coming up. Next week, Dr. Linda Rothman is going to also be talking about road safety as a public health issue. And then on the 21st of October, we've got Dr. Raktim Mitra, who's my colleague from the School of Urban and Regional Planning, sharing his research on mapping children's healthy activities during COVID-19. So thank you to everyone for joining us today. We really appreciate that you were able to come. We look forward to seeing you soon and have a great day. Thank you. Take care.
Thanks, everyone.